Let me tell you about a time when a patient looked fine until he absolutely wasn't. And that's exactly why nursing diagnosis matters. I had a patient come into the ER, probably mid 60s, came in for some shortness of breath, and nothing too crazy, nothing profoundly obvious that were terrible. Two sats are like 92, 93%. He's a little bit tachypnic, but something feels off. He's sitting there, he's quiet, he's not really complaining. Not the patient that's giving me a bunch of grief. He's not asking for anything. But if you've been in healthcare for any length of time, you know that when your patient isn't asking for everything and being demanding, that sometimes is the worst sign. Within about 30 to 45 minutes or so, his oxygen tanked into the 80s, and he just started working hard to breathe. That work of breathing is so important to monitor it. So here's the thing: if you're stuck thinking about medical diagnosis, you're just saying pneumonia or respiratory issue, but that doesn't help you act. And that's why we do the nursing diagnoses. And I know I remember us being in school and thinking this is the stupidest thing ever. But the whole point of it is your nursing diagnosis in that moment is telling you, what do I do? And you may not always put it out on paper, and that's okay. But understanding the framework behind it is what's going to help you. So in this case, my nursing diagnosis in that moment is impaired gas exchange. Why? Because he's not oxygenating well. He's not oxygenating effectively. And then what's the evidence to support that? To support that is the dropping oxygen saturation. He has increased work of breathing. That tells me exactly what I need to do for him. So what I want you to think is, what's the biggest problem right now? What's causing it? What am I seeing? That's your diagnosis. That is your nursing diagnosis. So if you can recognize the problem early, you can change the outcome. And that's why this matters. I hope that helps.